users are victims of the tobacco industry's well-known tactics to trap the youth before they reach maturity and adulthood. This initiative will also help Jordanians access the information and tools they need to quit. I hope Florence speaks Arabic, by the way, but also offers them the nicotine replacement therapies and medications necessary to aid them in their journey of quitting and starting to lead healthier lives. Jordan is a proud party of the Framework Convention on Tobacco Control and has a strong group of grassroots NGOs fighting for tobacco control. I might say most of them are women, just an FYI, that is shaking the status quo and improving step by step the enforcement of the law in Jordan. Just last week, the government of Jordan adopted a ban on smoking indoors in public places. The link between smoking and COVID-19 make it essential for governments to pass comprehensive tobacco control laws that will protect the health of their people during this pandemic and beyond. We must do better with this new initiative. The government can show that Jordan is invested in strengthening tobacco control measures and saving lives by implementing proven measures based on FCTC and WHO's Empower, like banning tobacco use in public spaces. I would like to thank WHO again and for you, Dr. Tedros, personally, for leading this innovative initiative and all of our partners for their support, including Johnson & Johnson for the significant donation of nicotine patches. This will help thousands of people overcome their addiction to nicotine and support them in their journey to a healthy life and free of addiction. Thank you, Dr. Tedros, again, for your leadership. We are so proud of you, and we are thinking of you day in, day out for all your efforts on fighting the COVID-19 and on making sure that we don't lose ground on all the gains we did in public health. Thank you for everything. And yes, I feel so honored that you also call me your sister and a friend, and I feel the same way. And thank you for Johnson & Johnson. Thank you.
Thank you so much, Princess Dina, for those really powerful words and the great news about the actions being taken in Jordan on tobacco control, and also for your support for the work against COVID-19. I'd now like to introduce Mr. Thibaut Mongong, the Chairman and the Executive Vice President, my apologies, Worldwide Chairman, Consumer Health for Johnson & Johnson. Mr. Mongong, you have the floor.
Yes, hi everyone, and we are very, very pleased to be joining you today for this important event. At Johnson & Johnson, we are committed to change the trajectory of health for humanity, as we all are today. And this initiative will really help people quit smoking. This is a very important public health milestone. It was made possible through the close collaboration between public and private partners. And this is, I believe, what makes its potential to succeed even greater. And when we hear Princess Dina, when we hear Dr. Petrus and the WHO's commitment, I have no doubt that this program is going to be very, very successful, starting with Jordan, but expanding well beyond Jordan in the future months. As we all know, good health is impossible without access to the right tools. We just heard about AI. And the right products. And in terms of
all right, we're going to pull away from the World Health Organization right now. We were hoping that they'd be talking about the COVID-19 pandemic. They're currently talking about smoking in Jordan. But when they dip back into the pandemic, we're going to listen in and make sure we bring you any news that is worthy. For now, though, we're going to pivot to Arizona and the prospects of reopening the schools in just a couple of months. Schools in Arizona are delaying the start of the upcoming school year as the state sees a spike in new coronavirus cases. And in Phoenix, the Phoenix Union High School District is taking it one step further. They are delaying in-classroom teaching, in-person teaching until October. October because of the spike. So let's bring in Chad Jestin. Chad, you're the superintendent for the Phoenix Union High School District. And let's talk about, the tough decision to do this. Phoenix is seeing an uptick in cases and hospitalizations. Tell me what it was that you were considering when you decided to delay in-person classroom interaction. And I want to ask you, so is school starting in September, but remotely, and then you're hoping that come October you'll actually have kids in the classrooms?
Well, yeah, to add to the complexity here in Arizona, we actually start in early August. And so I know there's a lot of states across the country that start post-Labor Day. Our school is supposed to start in 3 weeks. And so in some ways, this was a really challenging decision. In other ways, it wasn't. As unfortunately, we are, in many ways, the epicenter of the spike in COVID-19 here in our country. And as we listen to staff and students and parents and think about the overall health and safety and wellness of our community, it became very obvious that it was time for us to pivot our energy into high quality remote learning and delay the start of in-school until the end of the first quarter.
Is that a hard start in October, or could that also change?
No, that could also change too. What we've decided is that as we listen to the community, our parents, our staff, our students, they don't want a new announcement every 2 weeks. They want to be able to plan for childcare, for their job. And so we've committed to going quarter at a time, and we will continue to watch what CDC says, what leadership says, and make decisions quarter by quarter that, again, guarantee the health, safety, and wellness of our community.
So as I've been listening to this conversation around the country and here where I live in Philadelphia, it's occurred to me that, some of the challenges for schools, if they have to do with not only sort of perhaps the CDC guidelines or the local health department guidelines, but also the physical restraints that you're dealing with. A school building is a school building. A classroom is only a certain size. If students are meant to say 6 feet apart, you can't expand the size of the classroom. Can you talk to me as you look ahead to the possibility of the kids back in the classroom? Talk to me about some of the restrictions, the protocol, all the things that you're sort of wrestling with to make sure that it's the safest environment as possible.
Yeah, absolutely. It starts from when a kid gets up and gets on a bus in the morning. And so we've had to calculate how many students can fit on a bus. Typically, it used to be 50 to 75. Now it's around 10 to 15 students per bus. Then we look at a classroom. Classrooms used to be able to fit 30 to 35 in a classroom. Based on our calculations, it's now only about 16 to 18. We have cafeterias that used to fit 5,000 or 500 of our students, but now only fit 50. We have to worry about passing periods. We have to worry about dismissals. How do we keep weight rooms clean? How do we keep band instruments clean and disinfected? And the list goes on. And in many ways, that's why we decided to shelf those conversations and make sure that we got back to the core of our work, which is teaching, learning, and wellness of our staff and our students in our community.
And we know across the country, thanks to, the shutdown, a lot of municipalities are wrestling with their budget. Some of the stuff that you're talking about, it's going to cost a lot of money. We've already seen schools across the country scale back on some of the things that they consider extras, including school nurses. And that is an issue in Arizona. There are fewer school nurses than there have been before. Is that one of the things that you've sort of considered as well?
Yeah, well, first of all, I think it's important to note that, we cannot rely upon school nurses to be the primary healthcare physician for entire school communities during this pandemic. And so I've heard a lot of conversation about the role of nurses, and we need more nurses. And it is unfair to tell a school nurse that they're responsible for an entire community. But yes, you're right, there's a shortage. And that's because there's a greater need in hospitals. There's greater pay in hospitals. And so schools have had to rely upon health assistants that have less certification and less training. So certainly we have that issue, but safety on a campus, it cannot just be left to one nurse or one health assistant. It's got to be about protocols and procedures that keep entire school communities safe.
All right, we're in this together. That's what we've been hearing since the beginning of this whole thing. So that's about getting kids in the classroom. But, you know, you indicated obviously before that, it's going to be all about remote learning. But remote learning is not as easy as for everyone as it could be. A lot of people don't have access to the internet. A lot of people don't have the devices. I'm just going to quote a study here, a new study by Common Sense Media, which is a Boston consulting group, found that 29% of students don't have access to the internet. That's more than 335,000 students. What's the situation in your district, and what are you doing to help those students that it's not so easy for them to log in?
Yeah, so the digital divide is wide in our nation. It's wide in rural America, and it's certainly wide in urban America. The same is true here in Phoenix. And so what we have had to do is we have had to reallocate our budgets to purchasing laptops for every single student here in Phoenix Union. We purchased enough to go to full one-to-one. We have also been purchasing and procuring hotspots. We now have 5,000 in our possession. We'll continue to purchase to fill that and bridge that digital divide. But it's also not just about, you know, how can one school district, it's about entire cities and states and countries. And so we're also in conversation with our city and with other school districts and private industry to say, what would it take for us to create an entire computer network across the city of Phoenix, and more on that to come. We're really excited about progress that will not be ready for the start of school, but we